morning, ladies and gentlemen. Can you hear me okay? Good morning. I'm just going to take a couple minutes and talk about the pharmacy outreach program. I'm actually filling in for someone. Dr. Hill couldn't be here today, but fortunately, I used to work at the pharmacy outreach program. I am a pharmacist. I currently work at the UMass Medical Center and teach at the Mass College of Pharmacy and Health Sciences just down the road in Worcester. But before I do what I did now, I used to work at the outreach program. So I'm going to tell you a little bit about that. I think some of you have already grabbed some bags and some of the materials. We've been able to provide these pill boxes for you on the tables. So what is the pharmacy outreach program? This is a free, it's a very big word, free service that can help you with any drug or health information questions that you have. You can call them on the phone, and they can help answer any questions you might have about your medications. They are funded, first of all, by the Central Massachusetts Council of Aging, the Office of Elder Affairs, and of course the Mass College of Pharmacy. It's run by a number of pharmacists, pharmacy students, kind of similar to the ones they're going to be talking to you later today. And also Shine-trained counselors to help answer any insurance or cost-related questions you might have as well. What do they do specifically? If you have a question about your medications, if after today you have some information and you say, oh, I want someone to review my medications to look for interactions, potential problems they might have, they can review your medication list over the phone and answer any of those questions for you. So it's a very valuable service for drug information, medication reviews. The other thing that they can do, and I think this is one of the most valuable things from the pharmacy outreach program, is they can help you with medication cost, medication access. Everyone know in October, the fall, when you have to review your Medicare Part D plans and pick a new plan, if that's something you have to do, that can be pretty daunting. The outreach program can actually review your medication lists and then recommend a plan that best fits what medications you're taking in terms of costs and completeness of coverage so that there's no issues with your medication access. They're very good at doing that, and that's a very valuable service in addition to the health information that they have. Some of the materials they've passed out contains information of how to contact the pharmacy outreach program. We have a flyer that's on each of the table seats and back behind you. Looks like this. It has the phone number to give them a call. I'll say it out loud, but you don't have to write it down. It's on these cards and the pill boxes, 866-633-1617. Usually it's a number of phone calls, so it may not be something they can answer right there, but they take your information, review your case, and then give you a call back and say, here's what we found, here's what we recommend, here's how to best access your medication. They do this for a variety of reasons. We want patients to be able to take their medications accurately, avoid side effects, and something that I'm very passionate about, I want our patients to be able to afford them as best as possible, and that's where the insurance piece of the reviews come in. The other thing they can review, and this is transitioning to our wonderful students today, is they can also look for medications that might be increasing your risk of falls. So to go forward with falls prevention and medication, we have wonderful students from the Mass College of Pharmacy going to talk to you today about fall risk. So I'm going to transition here, and we're going to give them an introduction, and they're going to give this nice presentation for you.
Good morning. My name is Dan Garofoli. I'm a pharmacist at the UMass Medical Center in the outpatient pharmacy. These are 3 students that rotate through with us and learn pharmacy practice from us. We have Ida Salehi, Yishan Lee, and Paravash Asadnajad, who will talk to you about falls prevention as they relate to medications. I would just ask to try to please hold your questions until the end of the presentation, or afterwards. We will be around afterwards to answer any questions that you might have. We'll stick around after the presentation as well. So without further ado, our first speaker is going to be Ida Salehi.
Good morning, everyone. Oh, wow, thank you. So my name is Ida. Today we're going to go over some things that may contribute to falls. We know that as we age, our risk of getting into a fall, whether it's due to, seeing some obstacles, or our muscle tone is like deteriorating, and that may contribute to falls. But as we can blame our age for it, there are some other factors that can increase the risk of falls. One of which being some of the medications that I'm pretty sure you might be taking, or that someone who is taking them. So with that said, we are going to be naming some of the medications that it's a good idea to look at with your doctor, with your pharmacist, and just make sure that you actually need them at this point. And we can go over that with you at the end of the session. So for my section today, we're going over some of these medications. Just a disclaimer here, the content of this presentation is for informational purposes only and should not be taken as substitute for medical advice. Always talk to your doctor, talk to your pharmacist before changing your medications, stopping them, or even take them at a different time of the day. So, for objective of this part, we're going to go over the medication that increases your fall risk. These medications are including but not limited to the blood pressure lowering agent, blood sugar lowering agent. We have some sleeping medications. We have some anti-anxiety medications, as well as muscle relaxant and mental health medications. So, for our first category, we have the medications that lower our blood sugar. So, why these medications may cause falls? They can contribute to lowering the blood sugar, so it may cause you feeling drowsy or dizzy when you get up. And some of these medications, I'm sure you already know, like insulin for your diabetes. We have like medication like glyburide, glimepiride, and some of that sort. So we need to be very careful taking these medications or injecting them. Our next category is the medications that lower blood pressure. So why these medications can cause falls? They can definitely cause dizziness because they drop the blood pressure, and that way they can increase the risk of falls. Some of these medications, I'm sure a lot of gentlemen are more familiar with these meds because they're also used for prostate problems. So these medications are like doxazosin, prazosin, trazocin. So we always want to be very cautious taking these medications as instructed by your doctor or pharmacist, because they might cause lowering blood pressure as you get up from the bed. So make sure that you have a bar or something to hold on to in case you feel dizzy. Next category being the sleep medications. So why? It's pretty obvious. They make you feel groggy, drowsy, and a lot of these medications, the body has a hard time clearing them from the system. So even if you do not take it the day after or in the morning, the effect can still linger around and still can cause some dizziness even in the morning after. So the big one here is zolpidem or Ambien. I'm pretty sure that a lot of people are familiar with that. We have some other agents listed here. Next category is anti-anxiety medications. These can also cause some confusion. And also, these effects are staying in the body for a long time, even after you take them. These medications are called benzodiazepine. Usually they have a Z in them, so like diazepam or Valium, alprazolam, which is Xanax, clonazepam, which is Klonopin. These medications are for use for anti-anxiety purposes, so they can relax you, they can calm you, but on the other hand, they can cause some confusion and falls. So next category, we have muscle relaxants. How they can increase your risk of falls is that they can make you feel groggy and confused, as well as other side effects that they have. They can increase your risk of falls, so we want to be really cautious when taking these medications. Some of these medications are listed on the slide. We have cyclobenzaprine or Flexeril. We have methocarbamol or Robaxin, which is an old agent. Also another one, but we just want to really make sure that we're taking these medications with cautious and just going over them with your doctor or pharmacist if you still need them. So for our last category, we have the medications that are used for mental disease. So these medications can also cause tremors, so like involuntary muscle movements, so that way they can increase your risk of falls. These medications names are on the slide, but these are just some of the examples. We have haloperidol, we have risperidone, or quetiapine. So just some agents to look out for when you go over, you're putting your medication in your pillbox. So yeah, just to be aware of these agents that you might want to talk to your doctor about them. So this is my reference. It's actually a great website if you want to look into. It's healthinaging.org, which has a great resources for not only just falls, but also different changes in our body as we age. So with that, I'm gonna hand it over to Yishan, my colleague. Thank you so much for your attention. Yishan, please.
Hi, ladies and gentlemen. Now it's my turn. So now let's move on to our part 2 of fall preventions. It's about the physical barrier in our daily life, and also some medication could worsen the outcome after falls. So for objective, today we have 3 major objectives here. The first one is to recognize the physical barrier in our daily life that can cause falls. And the second one is to recognize some medication that could increase the risk and worsen the outcome after our falls. And the third one is to how to implement some strategies to prevent falls. So for the physical barrier in our daily life, I have here like folded carpet. Oh, sorry, it moved too fast. Like this picture showing here, imagine you trip over through those folded part, that could be risky. And steps like this picture here, and also cords, like we all have a lot of electronic device at our home, so cords are like inevitable. And also sudden elevation or sinkage of the ground, like this one here is clearly not flat, so be careful with those. And also watery or icy ground, those can get super slippery. So you also need to use extra cautious. And last but not least is when you're trying to reach for things that are out of reach. Imagine you're standing on a chair reaching for something that is even taller than you with that chair. It's like gonna get risky. So how to protect ourselves from physical barriers? First, we might need to see everything clear so that we can see it and when go through it smoothly. So a new pair of glasses may be needed, and also treatment of eye problems such as cataracts, glaucoma, or other conditions that can impair your visual field can help prevent falls. And I have some common visual screening tests here. The first one is the visual acuity test. It's like this picture showing here. We always got that in our eye clinic doctor office. And the next one is a refraction assessment like this one showing here. This one is probably used most when you're needing a new pair of glasses, like they test you with different degrees of the glasses. And the next one is for the visual field test. It's like something like this one here. And also it's important to do a regular screening for glaucoma and also the retinal examination like this picture here. And also the use of assistive devices such as canes, walkers, reachers, handrails, grab bars, or even raise the toilet seat in the bathroom can help you prevent falls. So I have a picture here as a representative of the reachers. It's used to help you to grab things without needing to bend over your waist or something. And also using a better lighting, such as having a night lights or lamps within the reach while you are still in bed could be helpful. And also removing those loose carpeting or other floor clutters to decrease the risk of tripping over, and also remove the dangerous furniture like unstable chairs or tables can also help you prevent falls. And last but not least, adjust the bed height to like below your waist level can also help a lot in preventing falls. So what can come after a fall? We know it's major two categories that can come after fall. The first one is broken bones, and the second one is bleeding. So this is just a small disclaimer that asks you to do not stop or change any dose of your current medication based on our lecture today. Always make sure you talk to your medical team member before you do any changes. And now let's move on to medication that could worsen the outcome after fall. There are major four categories. The first category is called the Proton-Pump Inhibitor. Some of you might get confused. What is that? It's majorly used for your stomach acid problem, such as acid reflux, or GERD. If you don't know that, that's okay. It's like some sort of stomach acid problem. Some common meds you might see on your home medication list could be omeprazole, brand name Prilosec, or esomeprazole, brand name Nexium. There are some evidence show if you are using those type of drug long term, like if you are using it continuously for like 1 year or 2 years or even longer, that can cause weakened bones and leading to easy fracture, especially if you fall. Oh, sorry, moved too fast. And the next category of drug is the tricyclic antidepressant and selective serotonin reuptake inhibitor. I know it's a real long name, but those are type of meds that are usually used for your like depression or other type of mood disorder. It's gonna help you with those. So some common meds on your home med list could be amitriptyline, brand name Elavil, or citalopram, brand name Celexa. Those type of drugs are also associated with weakened bones, leading to easy fractures, especially after you fall. And the next category of drug we have here is anticoagulants, which is also commonly known as blood thinners. Those are gonna help you to prevent blood clotting in your body, leading to like stroke or any other type of serious disease. Some common drug you might also see from your home med list should be apixaban, brand name Eliquis, or warfarin, brand name Coumadin or Jatovan. Those are the common drugs. And those type of drug actually helps prevent from you getting any blood clots. So one major thing we're concerned about, it could lead to a lot of bleeding after injuries like falls. So here it's important to know if you ever fall and you are also on this type of medication, you will need to call your doctor or 911 immediately. And the next category of drug we know as aspirin or NSAIDs. I'm sure many of you are on it or gonna be on it. So like those are type of drug also available as a over-the-counter medication for some pain relief. And they also have some side effect leading to bleeding. So if you fall, that could worsen that as well. So some common drug we have here is aspirin, brand name Bufferin or Ecotrin, ibuprofen, brand name Motrin or Advil. We can see like Advil or Motrin commonly on the CVS or Walgreens store shelf, so you need to be extra caution when you are using them. And also naproxen, Aleve, is also available as over-the-counter drugs. And here I just put a small note that is, this is not a complete list. Many of those type of drugs are also like both available as prescription drug and also the over-counter drug. And some of them are even in like some combination drug. So you need to be extra cautious with that. And here, as a reminder, just do not stop or change any dose of your current medication unless told to do so by a member of your medical team. And last but not least, let's summarize this. How to prevent ourselves from falls. First, you need to talk to your doctor if you are currently taking the classes of drugs like above. And always check with your healthcare provider or pharmacist before starting or taking any over-the-counter drug or supplements, which my colleague will talk more about that later on. And be extra cautious when dealing with physical barriers in your daily life. And also maintaining an adequate intake of calcium and vitamin D through your daily diet and supplements is also important. And here are some references. And now let's welcome our next speaker, my colleague Parivash.
So, hi everyone, my name is Parivash Asadnejad. I'm the pharmacy student of Mass College of Pharmacy, and today I'm going to talk about the over-the-counter and herbal medications and the myths behind them. Today's objective is the definition of the over-the-counter and herbal medications, what are their types and what the risk associated with using them. What are the CBD and THC, the myths about the over-the-counter medications, and how we can advocate ourselves in the provider's office visit. Over-the-counter medications are the ones that we can easily get them through the pharmacies, grocery stores, and even gas stations. As they call, it's over-the-counters. They doesn't require any prescriptions, and the chances that we use them during our life is so high to using for common indications like cough and cold, as a sleep aid, or for headache, constipation, and nausea. And we consume them based on the labels, direction on the package of these medications. What are the types of these medications? As I earlier said, they have variety of indications that we can use these medications. The common one is the cough and cold medications, some stimulants like energy drinks, caffeine pills, decongestants like Sudafed, pain relievers like Tylenol and ibuprofen, motion sickness medications, and some sleeping aid and allergy medications, the big one which is Benadryl, and supplements and vitamins. What are the risks associated with the use of these medications? As we call them, these are medications, and obviously going to be some still risk with the use of these medications. They could interact with the medications that we're currently taking, or supplements, or foods, or any drinks. These are not right for certain people with certain medical conditions. As an example, people with high blood pressure, they should not use some decongestants like Sudafed. And as these are medications, people are gonna have allergies to some medications, so these are also falls in that category. And the big one, which they're gonna have adverse effects, like some of them can cause you drowsiness, dizzy, lightheaded, or tired, and they can increase the risk of fall. Now we reach to the herbal medications. These are the natural source of the medications. Dietary supplements, the big one on this class, they can find in the different forms like teas, extracts, parts of a plant, even capsules, tablets, powders, and we can access them easily without prescriptions. These medications are not expensive, and the effect of them are not predictable. So there's lack of regulations, and how much we're taking them, it's not regulated. So we should be cautious, and also, same as the over-the-counter medications, they're gonna have their own side effects and adverse reactions. So we should be more cautious to avoiding the risk of fall in us. In other parts of the plant medications are the CBD and the THCs. So the CBD and the THCs are the two most prominent parts of the cannabis. And the THC is the part of the cannabis which is produces the high associated with the marijuana use. And the CBD is mostly found in the hemp, and it's not associated with the high. These are used for to treat various conditions like pain, anxiety, epilepsy, Alzheimer. But the most important thing is that these medications can interact with some other medications that we are currently taking. And they're gonna have adverse effects like other medications, like dependence, drowsiness, dizziness, decreasing the appetite. So we should be cautious with them and avoid the risk of fall in us. What are the myths about the over-the-counter medications? You hear that if I'm taking one, two will be better, but it's not the right case. So we should use the over-the-counter medications based on the package insert, which is the label inside the bottle or across the bottle. So we should go by that direction. What works for me will work for you. Some people have allergies, or some people have more side effects to specific medications, like the over-the-counter medications. So what is work for me will not work for you. And also, the accidental poisoning in children won't happen if I store all my medicines up and away. It's not a good idea. As we keep it upper, the children will not reach to that, so it's better to keep them in a safe place, just out of reach of the children, so they cannot use it. Also, the last one is most side effects from medications can resolve by themselves, which is not true. If we're taking a new medication and we are not feeling the right way or the usual way that we feel, we have to call our doctors, or if it's more emergent, just call 911. And as a disclaimer, we should not stop or change any of our medications. Always we have to discuss with our doctor or pharmacist regarding the change in the medication. Now reaching to the point that how we can advocate ourselves in the provider office and the pharmacies. Always we have to inform our doctors or pharmacists about any over-the-counter and herbal medications that we are taking. Also asking any questions that we need to know about these medications, like their interactions, their side effects, and also we have to consult with our pharmacists and doctors prior to purchase any new medications. So what questions we're gonna ask from our providers? Usually for any new over-the-counter, which is included to the herbal medications as well, and prescription medications, we have to ask them how much or how many I should take. Should I take it 1 tablet, 2 tablet? How many I should take? How to take? Should I take it in the morning, in the afternoon, with meal, without meal? Or how often should I take it? How long to take? Is it for a short duration of time, or should I take it for a long duration, more than 3 months? And the big questions that we should always ask from our doctors or pharmacists, what interactions these medications will gonna have with my current medications, and to be aware of those. How do we know we are getting the right over-the-counter medications? Reading the medication label carefully, be careful about the combined ingredients. There's variety of the cough and cold medications with similar agents on it, so we should avoid doubling up on any ingredients. Also, following the warning sign on the medication label, talking to pharmacists prior to purchase, and knowing that self-diagnosis is not an advice. Thank you for just listening to me. We are so happy to be here, and if you have any questions, we are ready to answer for you guys.
So another thank you to all these students who put this together. Could we give them a nice round of applause? They worked hard on this, so thank you, everybody.